My name is Pierre. I am full professor at the University of Tel Aviv in the field of anesthesia and critical care. I am the head of the General Intensive Care Department at the Beilinson Hospital Rabinal Medical Center and the head of the Institute for Nutrition Research in the same institution. I am the past chairman of the European Society of Clinical Nutrition and Metabolism and the present chairman of the Israel Society for Clinical Nutrition. Malnutrition is one of the main problems in hospitals. The reason is multiple. Patients may arrive already with a decrease in weight. They may have a decrease in food intake. They may have some diseases that are impairing their absorption, or they may have diarrhea or surgical problems. All these reasons bring them to the hospital already with a decrease in nutritional status. In addition to that, while they are in the hospital, they are not able to eat properly. Why is that? Because they have a decrease in appetite, because they have some investigations that have to be done, but also many times because the food that is provided to them during this period of time is not adequate to their needs. The problem is that they may be allergic, or their taste is not adapted to what they are provided. The problem is also that the food is not always warm enough, and the food is not enough in a presentation that is stimulating their appetite. Therefore, we have a big problem here. The problem is that the patients may be already in a condition of undernutrition, and in addition to that, they are not provided with adequate nutrition while they are ill, hospitalized, and sick, and then requiring maximum of food intake. Well, this problem has been observed by different surveys, like Nutrition Day survey, which is a huge process of auditing of nutritional intake in hospitalized patients in more than 50 countries over time from 2006. More than 300,000 patients have been collected during all this period of time from Chile to Japan, knowing exactly which country is doing better or not regarding the oral intake during hospitalization. With this huge amount of data, it has been demonstrated that if the patient has not a good oral intake and eating less than half of his plate during lunch, for instance, well, the length of hospitalization will be longer, the number of complications will be higher, and the mortality will be increased. There is a very direct link between the oral intake during hospitalization and the morbidity and mortality of hospitalized patients. And the worse the patients are eating, the higher the complications. Therefore, we have to make all our efforts to bring enough food to the plate of the patient and to help the patient to eat this food. We did two things regarding this. First, we improved the presentation of the plate while giving the adequate calories and protein to the patient. And with the help of a gastronomy institute called Bocuse in France, we succeeded to demonstrate, and this was published, that this improvement in intake by just presenting better the plate was associated with a decrease in length of hospitalization and a decrease in readmission. The second point has been very nicely shown by Philipp Schütz in Switzerland by increasing the nutritional additional intake of patients with malnourishment and showing in thousands of patients that this was improving survival in these patients. So this is a very important result, because this is bringing evidence that nutrition can change outcome in patients. At the least, we know that we have to organize all the administration of food in hospitals because of a huge waste of food. Mostly 70% of the food is wasted in hospitals. And this is really a waste of money as well. We have to create an adaptation between the needs of the patient and the delivery of the food. And there are new systems like FoodFix that are able to screen a patient, assess his malnutrition, and then select what is needed for the patient according to the disease, according to the allergies, according to the requirements, and bring to the patient exactly what he needs, so that the waste will be decreased, but mainly the intake will be increased. And if the intake is increased, definitively we will be able to affect the morbidity and mortality, improving the survival of the patient, and decreasing the costs of food in the hospital, so that the patient will be improving and the hospital will spend less money for that. We need a system that will be able to support the dietitians that are working very hard in the hospital, because they are not able to be sure about the intake of the patient. The meal is brought to the patient by some health workers that are not monitoring the food that has been taken by the patient. And there is no real-time knowledge about what the patient is eating exactly in comparison to what he is needing to eat. Therefore, FoodFix will be able, in a real time, to let know to the dietitians of the hospital how much the patient has been able to eat and how much he will require more if there is insufficient food intake. This is a true monitoring, continuous feedback to the nutritional system of the hospital to improve the intake of the patient. Thank you very much.